8 बजे आ गई थी, लेकिन फिर मैंने टाइम देखा तो आज 10 का
आज
था।
चल वो लास्ट मिनट में वो 8:30 रख दिया, मैं 8:30 को भी नहीं आ पा रही थी।
निकलने वाली थी, जाने वाली थी, फिर मैंने बोला आप 8 बज रहे हैं, फिर मैंने इधर नाश्ता
हाँ
किया
कॉल।
साथ में।
अच्छा।
तो जब मैंने टाइम देखा, मैंने कहा फिर मैं 10 बजे दोबारा आऊंगी, तो यहाँ
हम्म।
मैं आज तो फिर ये मुझे मिली यहाँ पर।
हाँ।
फिर मुझे मैंने बोला नहीं 8:30।
अच्छा, आप लोग जानते हो एक दूसरे को?
इधर बात बात हुई है।
अच्छा, ओके। हम्म। हाँ हाँ। ये क्या है, मैं एनाटॉमी बस थोड़ा दौड़ा रही हूँ क्योंकि सब जानते हैं और ज्यादा इंपॉर्टेंट क्वेश्चंस नहीं आते इसमें। कितने, 4 या कुछ ऐसा ही वेटेज है, 4 क्वेश्चन आएंगे शायद, 4 या 6 ऐसा कुछ ही है। तो इसलिए मैं इस पे दौड़ा रही हूँ क्योंकि मेन तो हमारा सीपीटी है। सीपीटी, तो सीपीटी जो फोकस है ना उसमें ज्यादा दो तो सही है। तो और इसमें से भी हम बोल नहीं सकते कि श्योर शॉट यही आएगा। मैं रिपीटेड तो दे सकती हूँ, श्योर शॉट बोल भी नहीं सकते। तो इसलिए मैं दौड़ा रही हूँ इसको लेके। ठीक है। हाँ, वो जो बुक में कोड सर्च करके निकालना और उसके गाइडलाइन वो ज्यादा इम्पोर्टेंट है। ये एनाटॉमी तो सब लोग पढ़ लेंगे इतना। मैं पहले आईसीडी सीएम से शुरू करेंगी, डायग्नोसिस। उसमें बहुत सारे गाइडलाइंस है, जो गाइडलाइंस के लिए क्वेश्चंस अलग से भी आते हैं, गाइडलाइन बेस्ड। वो सिर्फ वो क्वेश्चन बेस्ड ना होके सिर्फ गाइडलाइन बेस्ड भी आते हैं। तो उसके लिए मैं कहाँ रहती हूँ? मैं दोहा जदीदा रहती हूँ। हम्म। मैं द व्यू हॉस्पिटल। हाँ, आरसीएम, वहाँ पे आरसीएम। आरसीएम इज रेवेन्यू साइकिल मैनेजमेंट। वो जो इंश्योरेंस हम बोलते हैं दूसरे हॉस्पिटल्स में, कहीं कहीं पे आरसीएम बोलते हैं उसको। तो इंश्योरेंस आरसीएम इज एक मोर और लेस सेम। तो आरसीएम में ही है एनालिस्ट। यहाँ पे अभी से बहुत है पहले ऐसा नहीं था।
इंश्योरेंस तो हर हॉस्पिटल में है।
फ्रेशर भी अभी क्या है, मेरे को 2-3 बंदे जानती हूँ मैं, जो लाइक टर्किश हॉस्पिटल, फिर एक कोई मेडिकल सेंटर, वहां पे सब सिर्फ फ्रेशर ही है। और ये किया हुआ है, सर्टिफिकेशन किया हुआ है। तो उनको क्या है कि उनको थोड़ा स्टार्टिंग है, इसलिए उनको लो पे में लोग चाहिए। ऊपर से क्या है, जो हब है उसके प्रिपरेशन के लिए, मैपिंग के लिए चाहिए, कोड मैपिंग। वो यहाँ पे एक बहुत बड़ी मुश्किल वाली बात है कि ये है कि यहाँ पे कोई भी हॉस्पिटल में आप जाओगे, सब कोड्स यूज कर रहे हैं, लेकिन कोड ये वाले कोड्स जो मैं बता रही हूँ ना वो नहीं यूज कर रहे हैं। वो अपने अपने कोड्स है सबके। अभी मेरे हॉस्पिटल में एबीसी है कैथीटराइजेशन का। हाँ, दूसरे हॉस्पिटल में कुछ और रहेगा, 1 2 3 रहेगा। तो क्या है कि मैच नहीं हो रहा है। अभी हब जो प्रोजेक्ट लेके आएंगे उसमें क्या होगा कि ओनली वन काइंड ऑफ स्टैंडर्ड, दैट इज सीपीटी। हाँ, गवर्नमेंट का रूल है। जो जैसे यूएई में आप जानते होंगे, यूएई में इट इज देयर हार्ड का जो रूल है, एचएडी का जो रूल है वो ये है कि तुम एक ही कोड यूज कर सकते हो। इट शुड बी स्टैंडर्ड, इट शुड बी थ्रू आउट द कंट्री। तो वो वाला हम कर रहे हैं। तो उसमें क्या, इन लोगों ने जो स्टैंडर्ड्स और कोड सेट बोला है वो सीपीटी है और आईसीडी-10 सीएम है और हेपिक्स है। और जो सीपीसी करने किया हुआ बंदे, वो ये तीनों उनके पास है उसका नॉलेज, बिकॉज दे हैव डन इट। हाँ, तो जो सर्टिफाइड है उनको बुला के क्या है कि कोड मैप करो, फिर दे आर गिविंग द जॉब्स, बिकॉज दे वांट इट। बिकॉज अभी आई थिंक मई लास्ट ऐसे कुछ बोला है, मई तक वो रिलीज हो जाएगा। तो मई के लिए वी डोंट इवन हैव टाइम। तो उस टाइम पे क्या है कि इन केस कुछ रहा भी तो ज्यादातर सर्टिफाइड वालों को सर्च करके उनके कोडिंग स्टेबलाइज करने के लिए बुला रहे हैं। और फिर अभी जो भी जितने भी इवन प्री ऑथ वाले भी अभी सिर्फ कोडिंग सर्टिफिकेशन जिसने किया है उसी को बुला रहे हैं, क्योंकि कोडिंग भी चाहिए उनको, मेडिकल नॉलेज भी चाहिए। तो जो करते हैं उन्हीं को बुलाते हैं सर्टिफाइड। क्वालिफिकेशन में लाइफ साइंस देखते हैं। यहाँ पे ज्यादातर प्रेफरेंस डॉक्टर, जैसे होम्योपैथिक डॉक्टर्स, उनको ज्यादा प्रेफरेंस दिया जाता है, क्योंकि वो मेडिसिन प्योर क्या है, पूरा जितने 5 साल पढ़ाई की है मेडिसिन, इस वजह से उनको प्रेफरेंस देते हैं। उसके अलावा जैसे मैं तो बायोमेडिकल इंजीनियर हूँ, लेकिन आई हैव एक्सपीरियंस इन दैट, बिकॉज ऑफ दैट मेरे को लेते हैं, सर्टिफाइड है और एक्सपीरियंस है तो वैसे लेते हैं। तो वो जो मैंने बोला कि टर्किश वगैरह में विदाउट एक्सपीरियंस भी ले रहे हैं कि बिकॉज सर्टिफाइड है। उसने हाँ लाइफ साइंस ही नहीं है अभी तो, विदाउट लाइफ साइंस वाले भी आ रहे हैं, कंप्यूटर साइंस करके आ रहे हैं लोग। हाँ, क्योंकि इसमें क्या है, स्टार्टिंग में भी मिनिमम सैलरी अच्छा ही है, ऐसा नहीं कि वेरी बेसिक ऐसे नहीं देते हैं। और क्या है, फ्राइडे सैटरडे छुट्टी, एडमिन जॉब है, 8 आवर्स जॉब है, फ्राइडे सैटरडे ऑफ है। तो सब लोग ज्यादातर लेडीज यही प्रेफर करते हैं ना। इवन डॉक्टर्स जो एमबी मेरे को मैं जानती हूँ एमबीबीएस किए हुए लोग भी ज्यादातर, जो भी आप जीसीसी में देखोगे, अगर इफ द पर्सन इज जीपी, जनरल प्रैक्टिशनर है, तो एमबीबीएस इज फुल्ली इनटू दिस, क्योंकि जीपी का सैलरी है यहाँ पे 10,000। ठीक है, ठीक है, आप बाहर देखोगे तो आपको पता चलेगा 10,000 सैलरी है। सेम पर्सन अगर इंश्योरेंस दिस फील्ड में है तो उनको मिल रहा है एज अ लाइक मे बी मिनिमम टीम लीडर या मैनेजर तो उनको मिलेगा ही। तो वो मैनेजर पोस्ट में देखेंगे तो मिनिमम सैलरी इज 25। तो वो 10 में काम करेगा 12 घंटे की 25 में 2 दिन की छुट्टी। और हाँ, 2 दिन की छुट्टी उसमें करेंगे ना तो ज्यादा वर्कलोड, इट्स जस्ट द जो एडमिन वर्क्स है भाई, लोड ज्यादा नहीं, क्योंकि हम अकेले नहीं कर रहे हैं ना, और भी लोग हैं, तो वो हो जाता है। तो इसलिए ज्यादातर एमबीबीएस वाले होम्योपैथिक डॉक्टर्स सब इसमें हैं, डॉक्टर्स भरे पड़े हैं। हाँ लिंक्डइन, नहीं नहीं, यहाँ पे क्या है, कहीं भी सीवी एक्सेप्ट नहीं करते, आप डायरेक्ट जाओगे तो वो लोग जस्ट बोलते कि इधर ड्रॉप कर दो, या फिर वो लोग ट्रैश में डाल देते हैं। सब ऑनलाइन में है, जो जितने भी हॉस्पिटल इधर, तो वैसे भी मेडिकल हॉस्पिटल्स और सेंटर्स की कमी नहीं है। तो कहीं ना कहीं, और अगर इंटर्नशिप या कुछ भी मिल जाए, पहले सैलरी अगर थोड़े कम में भी मिल जाए तो भी, इफ यू जंप 1 ईयर एक्सपीरियंस में जंप मारे तो भी यू विल हैव बेटर। हम्म, तो वो अच्छी बात है। इंडिया में जब मैंने शुरू किया तो भी मैंने ऐसे ही किया था, जब हाँ मैंने 5 साल एक कंपनी में काम किया, उसके बाद जैसे जंप मारा काफी डिफरेंस था। हाँ, मैं वहां पे करियर शुरू किया एजीएस हेल्थ से। हाँ, इट्स वेरी फेमस। एजीएस हेल्थ से शुरू किया, फिर गेप्स, फिर फिर आ गई वापस एजीएस में इधर। ओके, डन। So what we were discussing on the procedures, right? So endectomy we just discussed. Now coming to next one, extracorporeal circulation, ECC. Heard about this? Circulation? ECC, extracorporeal circulation. You wouldn't have heard this extracorporeal circulation, but instead of that, another term you would have heard, something like heart-lung machine. No heart-lung machine. Heard of it? What is heart-lung machine? Yes, exactly. So it is the function of heart-lung machine is, I'm having a heart problem. My heart is getting surgeried or repaired by doctor. So, so at that time, there is no supply. So what should I do? If you're, it should be alive, right? Heart should be alive. How will you keep it alive? You're working, you're repairing the heart. But how will you keep the heart alive? Because there is no functioning in the body. So something external machine you are using, heart-lung machine you are using, which functions similar to the heart and lung functioning, the circulation of blood. Okay, the oxygenation, deoxygenation, that system is done by this machine temporarily until the surgery is done by the physician. This is very important. Okay. It is very critical, crucial surgeries that we perform on hearts will be, the circulation will be maintained by this heart-lung machine, which is also known as extracorporeal circulation. Okay, with the term you may be able to capture it, circulation. Okay, so a heart-lung machine used as bypass to divert blood from heart and lung while heart is being repaired. Holter monitoring, very common. Holter monitoring is for, what is Holter monitoring? Holter, yes, it is ECG. Okay, it is a mini ECG, compact. This compact version of ECG worn by patients to detect arrhythmias. Okay. PTCA. Heard of PTCA? Another important. We all were discussing about this. PTCA. Yes, it is percutaneous transluminal coronary angioplasty. Okay, percutaneous transluminal coronary angioplasty, also known as angioplasty. Okay, what is the working of angioplasty? Shape the blood vessel. Okay, why are they shaping the blood vessel? What is atherosclerosis? Yes, some deposits. They are clearing, basically they are clearing the vessels. They inject the dye. They may inject dye to monitor gram, or they will put in a balloon, expand the vessels, okay, deflate the balloon and take it off, or they may place, yes, stent. Okay, stent will be placed to keep it open throughout. So you would have heard angioplasty with stent, without stent. Without stent is normal inflation and deflation of balloon. So these are very important procedures which you might get confused in the CPT. So at least know the terms to understand the difference. When should we code with the stent, without stent? What is the working? So you will be easily able to pick the codes. Okay. So mostly everything is done. Lymphatic vessel is what? In the system, we also have lymphatic trunks. Okay. Lumbar, interstitial, right, thoracic, lymphatic ducts. So this is also part of circulation, but not as important as blood circulation. Okay. So it is related to lymph nodes. You would have seen some swelling. So it is because of lymph node where the fluids are not, there is inflammation in the nodes. Okay, lymph nodes, it may give you that inflammation, or maybe the fluid which is flowing through is having some block, that may also lead. Okay, so based on that, this is what, everywhere there is a lymph node, the areas where we can find in our human body, the lymph nodes, where and all it is situated. So tonsils, spleen, thymus, these are the areas where lymph organs, these are also known as lymph organs, tonsils, spleen, thymus, Peyer's patch, appendix. Okay. So myocardial infarction, we didn't discuss myocardial infarction, right? MI. MI is another important condition, myocardial infarction. What is myocardial infarction? Yes, we learned kind of infarction somewhere else. Did we learn? Cerebral infarction is also there. Okay. So myocardial infarction, based on myocardial infarction, when did it happen? Okay. Yes, acute chronic myocardial infarction, and based on the type of infarction and within how many days the person is again visiting the doctor for the same condition, that is within 28 days or after 28 days, will also define how to pick the code. So myocardial infarction, we have entirely different coding guidelines in ICD-10 CM that we will learn in depth. This is, keep in mind that this is very important. It is a special guideline that we have in ICD-10-CM for coding myocardial infarctions. Okay. So subsequent episode of care designation restricted to new MI. So it is MI, new MI. When to code MI as new MI or old MI. That is how it is. So it is the 4 weeks. During 4 weeks healing period, not used for re-evaluation, observation or treatment of MI treated on previous admission. Same code for benign or malignant hypertension. Okay. This when I say, you will not be able to understand, but with the guideline, it will be easy for you to understand. So this is done. Next. We discussed mitral. Did we discuss something like murmur? What is murmur? We discussed lub dub. We discussed flutter. What is murmur? This abnormal heart sound is murmur. Okay. So what is vein? Vein carries which kind of blood? Deoxygenated blood is carried by vein. And pulmonary vein? Okay, very important. Now coming to respiratory system. Done anything on this heart? Do you have any questions? We'll have more questions when I come to ICD-10-CM, because here things are very similar and known things. Okay. Now upper respiratory tract. So we have upper respiratory tract and lower respiratory tract. Upper respiratory tract is basically from mouth till the throat, you know. So nasal cavity, paranasal sinuses, pharynx, larynx comprises your upper respiratory tract. Lower respiratory tract. It is trachea, bronchi, lungs. What is bronchi? Bronchi? Yes. Okay. The branches. Okay. Nasal cavity. Nasal cavity, nostrils, nasal septum. Okay. Turbinate, inferior, middle, and superior turbinate. So nose, if you see nasal cavity, we have sinus region. Okay. Where we may have this condition called sinusitis. What is that? Inflammation in the sinus region. Okay. So you can just go through where is what. Pharynx, larynx. Okay. Pharynx is above, larynx is below. So all those sides just go through. Paranasal sinuses. What are they? We have maxillary, ethmoid, frontal, right? Frontal area, sinus regions, sphenoid. Tonsil is again lymph tissue. Pharynx is divided into 3. What are the 3 portions? Nasopharynx, oropharynx, laryngopharynx. So pharynx, what is nasopharynx? Near to the nose. Okay, near to the nose is nasal cavity. It is called as nasopharynx. Oropharynx is near to mouth. Okay, closest to the mouth. And laryngopharynx is larynx. Okay, larynx and pharynx branches. It branches the larynx and esophagus. Then larynx. Larynx, what are they? What do we see? Yes, voice cords. Okay, voice cords or vocal cords. Vocal cords surrounded by cartilage. Contains vocal cords surrounded by cartilages. So there we again have epiglottic thyroid, okay, three unpaired cartilages. The cartilages that we have in the larynx, that is three unpaired and three paired cartilages are available, which we call as thyroid, cricoid and epiglottic, which is three unpaired, and we have cuneiform, arytenoid and corniculate as three paired cartilages. Okay. Epiglottis. What is epiglottis? Yes, very important. Larynx is there. It is kind of a lid opening. Okay. It is kind of a lid which is situated above the larynx region, that is known as epiglottis. And what's its function? Yes, very important. So larynx is for what? Larynx is for breathing, respiration. So when food enters there, yeah, it will be a problem. So food path is not larynx. Food path should be through esophagus. Food path should be through esophagus. Should not go to the larynx because it is near to each other. So it should go to it should not go to larynx. So preventing food to flow through the larynx is what is controlled by epiglottis. Okay, so it sees. So next we have trachea. What is trachea? Windpipe. We say it as windpipe. What is the function of trachea? Yes. So it has branches, bronchus. Okay. It has each bronchus leads to separate. It has branches, bronchus. Then from bronchus we have bronchioles. Then alveoli. What is alveoli? Yes, clusters of air sacs. It is actually air sacs. You can, I don't know if I have a picture. Okay. Trachea. This is discussed. Windpipe, bronchi, lungs. Yes, you can see. It's not here. Okay, basically it is the end. Okay, the end of these branches you can see alveoli. That is air sacs. Cluster of air sacs at the end of the bronchioli is known as alveoli. It consists of what? What does all these branches carry? What carries? Oxygen. Okay, oxygen, and it also along with the hemoglobin, it is passed on to different body parts. Okay, then lungs. How many lungs? Okay, two lungs. So how are they? How many lobes do the lungs have? Huh? Two left and right lungs. How many lobes? Yes. Why two and three? Okay. So we have two lobes. So you should be able to understand the lobes, because even based on the lobes, the procedure may vary. How many lobes were, and you should be knowing something like what is resection and excision. Okay, that is also important. So in certain areas, when they say as excision, you should be able to mark it if it is entirely the organ or only the portion of that organ. Based on that, we define excision and resection. Resection is entirely that maybe the organ or that whole region is removed. Excision is only a portion is removed. Okay, so lobes will also define you to identify excision or resection. Okay, so that is done. Hilum or hilus. It is midline region where blood vessels, nerves and bronchial tubes pass through. Okay, and it extends from collarbone to the diaphragm. Okay, that area is called hilum. Now, what is diaphragm? What is the function? Yes, when we inspire and expire, right? Inspiration and expiration is monitored or controlled by a muscular region, which is known as diaphragm. Okay, it aids the process of breathing process. During in inspiration, what is actually happening to the diaphragm? It is going down. When we inspire, it is moving down. Okay, then what is happening when it moves down? The thoracic cavity, yeah, enlarges. So there is more space for air to go in. When we inspire, goes down, more air space for circulation, right? Enlarges area in thoracic cavity. It reduces internal pressure. Air flows into the lungs. Okay, this is how the diaphragm works when it is inspiration. During expiration, it's just the opposite. It moves upward, reduces the thoracic cavity. It pushes the pressure outward. Okay, air flows out of the lungs. Now, pleura. What is pleura? So we have conditions like pleuritis. Okay, pleura, it is each lung enveloped in double folded membrane. Okay, the membrane of the lung is called pleura. Okay, outer layer is called parietal pleura and inner layer is called visceral. Okay, visceral pleura. Then we have pleura. Thin serous fluid is what it is composed of. Okay. Next, epistaxis. Coming to the pathologies, epistaxis. Very important. What is epistaxis? Yes, it is the bleeding of nose. Upper respiratory tract, we have conditions like, which I told already, sinusitis. Yes, tonsillitis. Then, yes, pharyngitis. Then, laryngitis. Based on each site, we have different inflammations or infections. Then, common cold is another condition that we have. It may be due to viruses, allergies. Okay, rhinovirus, we have common cold. Then airborne droplets, something like external agents. Okay, then we have influenza. Influenza, we have A, B, C. Okay, we have different influenzas. Then whooping cough. What is whooping cough? It is also known as pertussis. Okay, pertussis or whooping cough. What is that? Yes, pertussis is a bacteria actually. So what is that bacteria? Bordella bacteria. Pertussis is a bacteria which causes this condition. It is actually another kind of cough. Okay, cough. It is followed by deep breathing. Whoop, whoop feel. Okay, that is what. Another important condition, lung related. Yes, pneumonia. Pneumonia. What is pneumonia? Yes, yes, yes. Inflammation of lung. Okay. It's correct. Both are correct actually. So what is happening is inflammation of alveolar region. Okay. Alveolar wall, when it is inflamed, is also known as pneumonia, and also fluid accumulations happen. So alveoli fills with purulent materials. So both are correct. Then tuberculosis. Tuberculosis is a, yes. So it is Mycobacterium tuberculi which causes tuberculosis. Then pneumothorax. Pneumothorax. What is pneumothorax? Yes, pleural space. It is again related to abnormal collection of air in the pleural space. Okay, it is called pneumothorax. Then pulmonary embolism, PE. Okay, PE is also another important area. What is happening in PE embolism? What will be found? Circulating clots. Okay, yes, clots. Yes, so embolism is again blockage of artery. It may be fluid, due to fluid or air that, sorry, fat or air, that there is a blockage or blood clot in the pulmonary region, artery. Okay. Then chronic bronchitis. All these are again related to bronchus. What is that? Bronchitis is inflammation. Okay. And this may be chronic. Since it's chronic, it is long term. Then asthma. Asthma, narrowing of bronchi. Actually, that will also be there for